Cyanosis is diffuse bluish discoloration of skin and mucous membrane due to increased reduced hemoglobin. For cyanosis to occur, reduced hemoglobin has to be 5 to 7 grams percent. And cyanosis is seen throughout the body, but more specifically it is seen over areas where skin is thin, like in case of lips, cheek, nose, earlobes and fingertips just above the base of the nail. And conditions which lead to cyanosis include arterial hypoxia or stagnant hypoxia. In cases of altered hemoglobin where there is poisoning, because of poisoning there is formation of methemoglobin or sulfhemoglobin, and dark discoloration in these cases is largely because of these compounds rather than the reduced hemoglobin. And conditions like polycythemia, where there is increased RBC leading to increased viscosity of blood, leading to sluggishness or decreased flow of blood, as a result of which there is increase in deoxygenated blood leading to cyanosis. So these are some of the conditions which lead to cyanosis. And most importantly, cyanosis is not seen in anemia, because for cyanosis to occur there has to be minimum 5 to 7 grams percent of reduced hemoglobin, but in anemia overall hemoglobin is reduced. So cyanosis is not seen in anemia. It's 1 minute. See you again in another video.